Welcome to Under Scrutiny. As I did promise you, I'm not a politician. That's why I keep my promises. I promised that I would have Dr. Baluku to talk about alcohol, separate myth from religion and religion from medical facts. We are going to answer the question, is alcohol probably harmful to your health, or is it really harmful to your health? Some have told us that little wine is good for digestion, or is it preventive to indigestion? All that and much more here on Under Scrutiny. Dr. Baluku, you're welcome again.
Thank you. Thank you very much, sir.
Now let's talk about alcohol. Is alcohol dangerous to our health? And if it is, how much of it?
I see. You see, that's not a yes or no question. If I said yes or no, then I would have defeated the purpose probably of this talk. Is alcohol dangerous to our health? I'm going to start by playing devil's advocate. Okay. I hope you allow me.
Yeah.
That alcohol actually could be beneficial to your health. Okay. And I'll start with research. Research has consistently demonstrated that alcohol reduces the risk of heart and vessel and disease of the vessel by on average of about 30%, the risk of those diseases.
Who does this research? Doctors drinking?
Yeah, no, I mean, I'll be honest with you that you even if you just went on Google as a lay person.
Professor Google.
Yes, as a lay person, Wikipedia as a lay person, you'd find this evidence. And even research is done by national institutions of health demonstrate the same.
Has this been published in some powerful medical journals?
Yes, definitely. But this benefit is more for people who have a risk of heart disease, especially men who are above 40 and women who are above 50 years.
Now that's not everybody.
Yes, not necessarily.
Okay. We are not talking university students.
Exactly.
So the university students drinking are not drinking for this reason.
Actually for younger people, young populations, it is actually worse because drinking per se also increases the risk of thickening of blood vessels in younger populations.
Okay. So we are saying where the benefit is, where is the benefit?
The benefit is if you are older
and
you have a risk of heart diseases.
So for you to get the benefit, you're saying, first of all, you should have a medically proven susceptibility to heart disease,
okay,
and you are older. And then there is a 30%
the 30%
reduction,
yes, of the risk. Yes.
Okay. Are we talking all alcohol, beers, spirits, wines, everything, and how much of it to attain that benefit?
Probably I'll come to that. Yes, but the other benefit also is moderate intakes of alcohol have also been demonstrated to reduce the risk of diabetes.
Moderate intakes.
Moderate, and I'll come to define what is moderate. I know you want to ask me.
Okay.
But I'll still give you at least just two more benefits to put it in perspective. Yes. A recent research about 1 year ago actually has demonstrated that women who are postmenopausal, normally women when they become postmenopausal, their bones become more fragile. Yes, but moderate intakes of beer have been demonstrated to increase and maintain bone density.
In this case, it is beer.
Yes.
Okay.
Yes.
Okay.
And
why beer? Because of the barley?
Probably.
Can some of these non-alcoholic barley-based drinks help as well?
Yeah, but you know, when we talk about an association, we're not talking about cause.
Okay.
It's an observation that women who take this amount of beer have been found to have. So probably the cause will be established sometime in the future.
Okay, so we talked about the older persons.
Yes.
Now we're also talking about the women who are postmenopausal.
Then diabetes.
And diabetes. Yes. And anything else?
Yes. Anything else? Yes. There's a disease.
Benefits.
Yes. There is this called Barrett's esophagus.
Barrett's esophagus. Oh, I'm not that bad.
If, for example, your gullet is the tube that you use for swallowing, is about to develop cancer. So it's called Barrett's esophagus. Alcohol, actually, moderate intakes have been demonstrated to reduce the chances of Barrett's esophagus.
Okay.
Lastly, is actually alcohol in the form of ethanol has been used in the treatment of methanol poisoning. You remember there's a time in this country where people took alcohol and became blind, others went to coma and died, you know. They had a poisoning of a type of alcohol called methanol. Alcohol can actually be used as a prescription in the treating of methanol.
Okay, so those are the benefits. Okay, now let's get to the dangers. First, let's begin where the men want us to begin. I am told that it tampers with the potency, the ability of one to behave like, in the biblical language, to know a woman.
Yes, of course it does.
Yeah.
In the short term, both in the short term and in the long term. In the short term, in that whereas it may excite, but it may excite and arouse, it takes away the performance, the ability to perform sustainably. And also in the long run, it reduces, allow me to say these words, it reduces,
you're a doctor.
It reduces testicular size, the size of the testicles, and this, of course, consequently, male hormones will be reduced significantly.
Okay, so there's a relationship between male hormones and testicular size.
Yes, and testicular function. Yes, function, not necessarily size. Yes, so a man who has been drinking for a very long time is more likely to develop feminine characteristics, may start developing actually breasts and produce milk because of the effect of the testicles, and therefore that will affect their sexual production. Okay. Yes.
You had promised to talk about moderation, and how much is necessary to serve the functions, the positive functions you spoke about.
Okay. When we talk about moderation, the guidelines say that at least a woman should have at least a maximum, sorry, not a minimum, a maximum of 1 drink per day, whereas a man is 2 drinks per day. Now you're going to ask me, what is the 1 drink? I'm not talking about 1 bottle. 1 drink, if you're considering beer, we are talking about 350 mils. 350. Yes, a woman should not exceed 350 mils a day.
So if you're drinking more than 350 mils a day and you are sure you're female, you're having more than enough.
Exactly. And when it comes to wines, we are talking about 148 mils. Wines. Meals. And when it comes to spirits, these spirits that have more pure alcohol, we are talking about 44 mils. That is the definition of a drink.
Is that the amount that also would leave the liver in a good place? Or is it true that all alcohol will certainly affect the liver, the functions of the liver in the long term? If you stuck to what the prescriptions, the amount, the volumes you're talking about, would you still have liver damage?
The fact is, as we'll see later, every amount of alcohol has its impact. When we say minimum, we are saying if you can't avoid it. Because when you look at the risk-benefit analysis, as we'll see the risks, despite these benefits, you are actually on a losing side if you decided to take even the moderate amounts. Okay. Even the moderate amounts of alcohol, for example, the ones we have mentioned, that cutoff, they are still associated with increased risk of breast cancer, colon cancer, cancer of the liver, cancer of the gullet, cancer of the colon, cancer of the rectum. So even the moderate intakes.
So you've given with the right hand, with the left, and taken away the right. So you're saying that it doesn't matter what the benefits are. Either way, the risks outweigh the benefits. Is that what I hear you saying?
I am saying that I think somebody who is rational should be able to weigh and see that the risks are more than the benefits.
Without being very, very political, what do you advise?
My advice is simple, that if you can avoid, as we shall see later, the risks, if you can avoid alcohol, you're safer. Nobody has died from not taking alcohol.
I haven't taken some, and I'm still all right. So you're saying 0.
That would be the best.
That's the ideal.
The ideal.
For somebody, in your words, rational and making very good judgment.
Yes.
Now you heard it from the doctor that if you are rational, well, we're not talking about those who are not, but if you are rational and you want your health to be the same place it should have been, then you're better off with 0 amounts of alcohol. And preferably, we advise 0 amount of wine. And if you can, 0 amounts of spirit as well. When we come back, the doctor gets deeper with this after the break.